Hey everyone, this week we're discussing President Trump and Republicans' attacks on healthcare in this latest bill. Representative Veasey and I will be joined by Congresswoman Andrea Salinas from Oregon, a new Dem leadership member and co-chair of the Bipartisan Mental Health Caucus. This is The Fly-In, a podcast brought to you by the New Dems. Let's get into the news of the week. Let's start in Texas. If you can just walk us through what you all have been through and what people should know.
Yeah, no, absolutely. And, it's a sad time for everybody in Texas. This it happened in Central Texas, but this Camp Mystic is so popular, and these camping grounds in the area are so popular. There were people from all over the state of Texas, including the area that I represent in North Texas, Houston area. This really touched everyone. There's a lot of politics and people trying to figure out exactly how this happened and why it happened. But the bottom line is that it's devastating because this is a time for kids to be able to, kind of get away from their parents, and for parents to be able to take a break and know that their kids are going to be someplace safe. And I think about all the times that my son, who's now 19, how many times we went and dropped him off at camp, a few hours from our house in East Texas, and what a great time and experience that was for him. And I would have never thought that anything like this could happen. It's at times it's even hard for me to watch any of the news coverage on it at all because it's shocking, it's heartbreaking, and the more I think about it, I think the sadder I get.
You're a parent, I'm a parent, and
Yeah.
so I think when something like this happens, we immediately think about it as parents.
Absolutely.
It became very political very quickly.
It did.
And I'm curious, you're closer to this than most as a member of the Texas delegation. What was your take on all that?
Yeah, well, at the very beginning, Greg Abbott's people said that it was National Weather Service, which was putting the onus on Trump.
Yeah.
And Trump's people pushed back. I think the thing that disappointed me was that the governor wanted to reassure everybody that him and Trump were still good friends and that they were still on the same team. And I'm like, no, we need to know what happened. I don't care if y'all are still friends after this.
By the way, that happened during the time when they were still looking for people.
Right, exactly. When they were still looking for people. And then they asked the governor a question about whose responsibility was this. And he gave this weird Texas high school football analogy that was just so inappropriate and bizarre. And he sort of rambled through it.
This is when you need serious leaders.
Yeah.
You need them every day, but
You do.
This is why we should be electing serious people who, when something like this happens, they are focused entirely on solving the problem, bringing people together. Politics becomes completely irrelevant.
And we do need to get back to that because this is a time, particularly with this, where this flooding is taking place, where we actually need serious leaders to be clear and to be, again, transparent and to be forthcoming about how we get through this and how we never let something like this happen again.
This is a hard transition. You have a bill this week. What preoccupied everyone's attention, and for a minute it was a nice distraction from the horribleness of what was going on and is still going on in Texas, is the fact that Trump is no longer interested in releasing the Epstein files.
Right.
In fact, he says it's not really an issue anymore. But you have a bill. Talk about your bill and why is this important?
Yeah, no, I have this bill that would, make the president release these documents because the American public deserves to see these documents. And, for the last, 2+ years, all we've heard is Epstein this, Epstein Island that, Epstein. And then all of a sudden, the president gets in power. He puts people around him and empowers people that were making a lot of money, that were literally eating and drinking off of this whole Epstein deal. You have Kash Patel, who's now the director of the FBI. You have Dan Bongino, who's the deputy director of the FBI. And Dan Bongino, he used to come on WBAP in Fort Worth, Texas. He had the national syndicated show. anytime you turned it on there, that's what they were talking about. And so all of a sudden now there's like nothing there, you know?
I think we are living in an era where this administration, enabled by congressional Republicans, it is all about, chaos,
Yeah.
Corruption, and cruelty.
Right.
And this really is getting at the corruption piece. And so, hopefully you get bipartisan support for this. I mean, I think the expectation for most voters is that your bill will get a vote and will pass overwhelmingly, and he will be forced to release these files because everybody is saying, oh, I would do it. I would, if it were me, I would do it. Well, this is your opportunity to force it.
Yeah, absolutely. They were hooping and hollering about this the last 2 years. It's time to show the American public what you got.
All right, good luck. Thanks for leading us.
Absolutely.
Well, let's first start by introducing Representative Andrea Salinas, a member since 2022, came in together.
Yes, we did.
This is our third year.
I know.
From Oregon.
That's right.
You are also a former Hill staffer. You worked for Harry Reid.
I did. Harry Reid, Pete Stark, and Darlene Hooley.
Wow.
Yeah.
So all three of us are former Hill staffers that are now members of Congress.
That's something.
Doing this today. That's kind of cool.
Yeah, that is.
I agree.
You enjoy hiking.
I do.
Music. Your favorite band is Green Day.
That's right.
You're a Portland Thorns fan, a big soccer fan.
Yes, women's soccer. Love it.
You're going to have to tell us why the Thorns at some point, why they're called the Thorns. And you chose to be a 49ers fan, not a Seahawks fan. Why is that?
Yes.
Well, I grew up in California, in the San Francisco Bay Area.
Okay.
And since I moved to Oregon, people in Oregon kind of split because we don't have a football team at all.
I didn't know
so,
that.
Yeah.
So half of folks in Oregon
I don't know
are
if half, but I think a lot of folks, split their allegiance between Seattle and San Francisco.
Wow.
In terms of football. Yeah.
And the Thorns, why do they call it Thorns?
So Portland is known as the Rose City. We have amazing gardens, amazing, landscapes. And so the roses, the thorns from the roses, like that's the tough part of the rose, right? So thorns.
I know that we want to talk about the three big things. Greg, you want to kick us off with that?
Yeah, so one of the reasons why we wanted to have you on was to talk about the healthcare implications in the One Big Ugly Bill and just how drastic the healthcare cuts are. Talk to you about the mental health care piece in particular. Let's start with the Affordable Care Act. This cuts significantly the subsidies that people rely on for their health care through the Affordable Care Act. 4 million people will lose their health care because of the cuts to the subsidies.
Yeah.
That's right. And this is the private market. That's what some people don't understand. This is the private market we're hurting now, too.
Yeah, and so, there's about 12 million people who will lose health care through the Medicaid cuts. And people were asking, well, how do you get from 12 to 17? It's because of the cuts to the Affordable Care Act.
That's right.
There are all these people who get subsidies through the Affordable Care Act, and about 4 to 5 million Americans will lose their health insurance because those subsidies are going away.
That's right.
Yeah, it's going to be very hard. If you try to come in and fix the damage that's going to be done later, of course, with the tax cut that's been put in there for the billionaires, you're just going to balloon the deficit even more.
The second is Planned Parenthood. This is one of the things that got overlooked by many. The bill goes after Planned Parenthood, and it says you cannot use Medicaid at any Planned Parenthood clinic, and this has nothing to do with abortion care because this is all clinics, and there are lots of clinics in your state.
Yep,
that
my district.
there's no abortion care at these clinics. No. They provide all kinds of reproductive and just general health care. And you cannot use that there. And that's for a lot of women, almost 1 million women, that's it.
And this doesn't really, yes, it goes after Planned Parenthood, but this provision goes after women. Yep. We're talking about women who have to travel pretty far sometimes, where Planned Parenthood may be their only clinic, like in my rural areas, where it's the only place they go once a year for their pap smear to make sure that they don't have cancer, uterine cancer, what's happening with their fibroids. It's the only place they can go sometimes for their mammograms. We are talking about places that don't even offer abortion service. This isn't going after just Planned Parenthood. It's going after women across the United States.
Right.
It makes me so
And
angry.
so explain on that a little bit, because that's the one thing that I hear from a lot of Republicans back in Texas. They're like, well, these women can just go to and get an appointment at an OBGYN, or go to a physician and go get one. They don't have to go to Planned Parenthoods, but even in urban communities like mine, explain why it's important that these clinics open. Because I have one, like, literally, that is in a predominantly Black and Hispanic neighborhood, very low income, that's very convenient for people to walk through, it's on a bus line. Explain to people why these clinics closing is a big deal to a lot of the communities like I just described.
It's a big deal because right now we are seeing a shortage of providers across my state and across America, right? We don't have enough OBGYN providers right now, especially given all of the attacks on reproductive health. Providers are afraid to actually practice because they're not certain about what the law says and what they're able to do in certain states. So like in Oregon, where our values are such that we have protected the freedoms of reproductive health, abortion care, postpartum care, everything. But the problem is that people are coming in from other states, and so the demand in Oregon has skyrocketed. The providers have not increased. Our rural clinics are closing, and sometimes the nearest provider might be a Planned Parenthood that is 2 hours away. So what are those folks supposed to do?
So they're going to close all of these Planned Parenthood clinics and rural hospitals, because rural hospitals treat a higher proportion of Medicaid patients than other hospitals, although children's hospitals are up there. This bill will likely mean that about 300 or more rural hospitals will close down. That's 20% of the rural hospitals in the country, and these are hospitals that are already, operating on the margins. I believe something like 200 rural hospitals have closed in the past 20 years.
Yep. So
you represent a rural district.
That's right.
I represent Cincinnati and rural Ohio. It means, at least for me, and I'm wondering, that folks will go from a 20-minute drive to maybe an hour and a half to get to most of their healthcare services, because all of the doctors, physicians, that support the hospital, they go away when the hospital closes too.
That's right. Or even worse, they have to seek care at the emergency room, right? Which is more expensive. It means you're not actually getting preventive care. You're having to go see somebody when the situation is so dire and catastrophic that you need help. And so that is the most expensive form of care, and it's not preventative. And so you're not seeing a primary care provider the way you might need to, say, if you have diabetes and your insulin needs to be renewed. You should not be going to the emergency room because you have some terrible incidents with your insulin. So that is also very catastrophic. Just this morning, actually, I heard on Oregon Public Broadcasting that one of my rural hospitals in Sheridan, in one of the most remote areas of my district, that their only rural clinic is at threat of closing right now. And they were just bought out by another rural clinic, but now they don't know if they're all going to be able to stay in service. So this is so incredibly harmful. And it's not just the rural areas either. We're going to see it statewide, nationwide.
And then lastly, the attacks on mental health funding. I mean, this is very similar to the opioid crisis, which is going to get worse now because you're pulling money out of the system, money that was being used for treatment. It's the same for mental health, right?
That's right. No, about $1 in $4 paid toward mental health is from Medicaid. Medicaid really is a cornerstone of mental health care in this nation, across the nation, not any one state, but across this nation. And so what we're going to see is, again, we have a huge shortage of providers in Oregon. And the National Institute of Mental Health rates all states. Oregon is down near the bottom in terms of access to mental health care. We're near the top in terms of the need. So we're suffering, but every state is a little bit different. We do not have a glut of providers right now. So the whole country needs additional providers. And when you start to take 25% of that funding out of mental health, people are going to be in serious crisis. I mean, we're already hearing, I'm hearing it. I've heard it from parents in my district and outside my district in Oregon asking, like, where am I supposed to send my child, my adolescent teen? There isn't enough pediatric providers right now to help with their mental health crisis. And kids are still trying to get over what happened during COVID. And a lot has changed since COVID. And so taking, again, 25% of funding out of mental health care in the United States right now, it'll be catastrophic.
And I think the message has to be as clear as I think we've been on this bill, which is they're stealing, they're taking health care away from 17 million Americans to pay for tax cuts for millionaires, billionaires, and big corporations. The fix here is to restore and expand investments in health care, including mental health care.
That's right.
By making the millionaires, billionaires, and big corporations pay all their taxes.
That's right. Yeah, there's an easy solution around this. And what I don't want to have happen is those people who are asking me, and from all walks of life, right? Lower income, middle income, even higher income parents who are calling and saying, look, we don't have enough providers. And this is something that the federal government could step in and say, hey, we know there's a way to fix this. And like to your point, Greg, we just need to pay for some of this. But the fact that they're even putting a cap on graduate school medical education now, that is going to harm this whole system. I've been working with my colleagues across the aisle to actually move forward bills that will increase the workforce, provide additional scholarships, additional loans, that sort of thing. But what happened in this bill, we're cutting it.
Yeah.
Now's not the time to cut, people.
And I think we do have to say it is restoring and expanding these investments because it was not enough.
That's right.
And then you cut it. So we're going to restore the funding and expand these investments in your healthcare.
That's right.
Yeah, that's right. In case you missed it, this is probably my favorite part of the show. This is a lot of fun. We have a good time with this, Andrea, so relax. Don't worry, you're going to do well. And so these are 10 things
I didn't study.
that you didn't know that were in the big ugly bill, or as I like to call it, the big bullshit bill.
Oh, is this fair? There's a lot in that
But
bill.
it's true or false, so you have to.
Okay.
You have
Okay.
to-
It's
Okay.
just
I can
this.
answer
True or
that.
false.
True or false.
Was this in the bill?
Yeah.
Okay.
Yeah, okay. Yeah. All right. Okay. The first one, the bill includes a tax cut for private jet purchases.
People are going to be so sad if this is true.
That is true.
Oh, that's gross.
And I think that there's enough said, right? I mean,
Yes.
this guy's all over the private jets.
I don't think there is enough said on this one. Hold on, Mark.
Yeah.
This one is crazy because, as I understand it, it's 100% write-off for any private jet, so long as 50% of it is used for business. So the other 50% could be used for whatever.
Caribbean.
Heading to this
Yeah.
Oh, wow.
festival in Oregon, and you get 100% write-off. It's insane, and they're taking healthcare away from 17 million people.
Yeah. That is-
Wow.
yeah.
True or false? The bill creates millions of new construction jobs in the clean energy industry.
This one makes me so sad because Oregon is a beacon for clean energy jobs and new industries that could be popping up: geothermal, offshore wind, and I'm a big fat false.
And even Elon says, right? I mean, you saw the tweet that he put out. He said basically this bill takes us back to old technology.
That's
so
right.
we're not investing in new technologies. And what ultimately will happen is that Europe and the rest of the industrialized world will rely on China to help provide this sort of technology that we're turning our back on right now. The next one. This bill will make student loans skyrocket.
True or false?
True or false? Yep, that is right. This bill caps student loans for graduate students far below what they cost. This is really bad.
Yeah.
As we just talked about,
Yeah.
I mean, I feel, again, we need more medical professionals. We need so many, we need nurses, and this is going to cost our young people even more to get into these different fields.
True or false? The bill directs $40 million to build a MAGA Mount Rushmore, the so-called Garden of American Heroes.
This is as bad as his birthday party. Yes.
Yeah, it's crazy. And what's scary about it is that the way that they continue to sort of elevate him in the same proportions, almost like he's a Jesus-like figure.
Like a deity.
Like it's bizarre.
Yeah.
True or false? This bill makes tax breaks for billionaires temporary, but tax breaks for the working class permanent.
Oh, Mark, that would be too fair.
Yeah.
That's false.
That is.
Bill does the exact opposite.
It
Yeah,
does.
that's right. Yeah.
The tax breaks are permanent for the highest earners, temporary for the lowest earners.
Yeah.
True or false, the bill will invest billions of dollars in clean energy development.
Again, let's change this.
Yeah. And it claws back clean energy provisions from the Inflation Reduction Act. These, it could be permanent if we allow it to be permanent, or we work our tails off, we get the Congress that restores these investments. Thanks for being on here.
Thank you. This was so fun.
It was fun to see you.
Yeah, likewise.
Thank you for joining us this week. Before we take off, please remember to follow us across social media platforms and to rate and review the show wherever you get your podcasts. We want to hear from you. We'll see you next time we fly in.